Migraine headache relief. We found research that 77% of the people who use this simple technique drop their headache pain dramatically.
Tanner, show the study online.
That's right. So I don't have to say it.
Yeah.
Migraine headaches, we found some research supporting that a very simple technique to reduce it. 55 participants gained notable relief.
Yep.
And with the simple
After
use
about 30 minutes.
with the cold pack,
Right.
we'll get in a little more detail on how to work with this. So to do this, obviously you need a cold pack, and you need a decent cold pack so when you pull it out of the freezer, it's pliable.
Right.
Okay, and it's comfortable because you're going to be putting the carotid artery on the side of your neck.
By
here.
the way, we have a couple of hot and cold packs.
Right. These are our cold packs, Bob and Brad from iRelief. They're excellent cold packs. They have a very nice side on one. They don't get hard when you pull them out. They're still pliable, which
Comfortable.
is absolutely necessary. Yeah, and
Yeah.
comfortable. So you can put it, here typically.
On the carotid artery.
Yep. You can go on both sides. And the relief from the studies report after 30 minutes, they had notable, significant pain relief.
Talk about these pillows, Brad.
Oh, yes. So the positioning I'm working here is, you notice I have pillows here, and there's a reason for that. And I'm going to rest my forearms on that, and that takes and elevates my shoulders and scapula. So
Shoulder blades.
So it relaxes these muscles here, and you're much more relaxed. When you relax, things work better.
Less headaches.
Less headaches, because you can get headaches simply from these muscles becoming over tight.
Exactly.
The levator, scapula, etc., upper traps.
Well said, Brad.
So here we go. Position like this, be in a comfortable position. Maybe even a chair that you can relax your head back on, a recliner or a nice soft cushioned chair.
We'll show that the next one now.
That's right. Now, there is a muscle, specifically I referred to it. It connects the shoulder blade all the way to the base of the skull. It's called the levator scapula. It's a muscle that's real commonly gets tight and knotted up.
It's a troublemaker.
Yep, it creates pain, creates headaches, shoulder pain. We're going to actually get over that. You have a big enough cold pack, you can get the carotid artery and over the levator scapula, which I have here. This smaller cold pack would work, but not as well as this size.
Right.
And we're going to leave that on there for up to 20 minutes. It's nice not to put these directly on your skin. I think with this material on these particular cold packs,
they're made for it.
Yep.
Yeah.
One side is, and you can clearly feel it feels like a cloth.
But
But if there's any doubt, put down like a pillowcase or some thin cloth for a little barrier.
Thin towel.
Yep. And just relax. If you haven't used a cold pack before, it's a little, it's cold, but give it about 30 seconds and you should feel the relief. Sometimes, some people, like myself, I put a cold pack on, it's very quickly comfortable. Everyone has a different feel for that. Another position you get these cold packs in comfortably, you see Bob here is laying very comfortably with a pillow lying under the neck and the shoulders. And these two pillows really can make a difference on allowing your shoulders and your arms to completely relax. The more relaxed you are, the more effective. Take a cold pack. We're going to go under here. There we go, and lay back. And the position of the cold pack is going to be a little bit different from person to person. That person will know. I'm going to put this one to get over that carotid. That's a nice size for that. This one here is a little bit bigger, but it's okay. I can get the other side here and tuck with that. Now, this is something that Bob could easily do himself and probably better off than someone else doing it, but just for demonstration and application, I'm doing it.
Feels good.
Yeah, so then you're going to lie there, 15, 20 minutes, relax. If you're feeling anything unusual, like it should continue to feel comfortable and better the longer you lay. If you're having some weird reaction from the cold, it may not be for you. Some people do not respond well to cold. Most people do.
Get rid of the headache.
Yep. Get rid of the headache. No medication. Just a simple, old-fashioned cold pack.